Ali is a 12 years old boy
Hmm.
born at time with no complication.
Okay.
Birth weight was 3 kilogram.
Okay.
Length of 50 centimeter.
Hmm.
There were no postnatal complication.
Okay.
Mother noted since the age of 9 years that
Hmm.
he is short, comparing him with his peers.
Okay.
So his
So I have.
parents are tall
Hmm.
and no history of short stature in family. Can you please take the history from mother? Discuss the management with the examiner.
Okay. Just give me some moment. Okay.
Yeah.
Okay. I can start.
Okay.
Okay. You keep the time. Hmm?
I'll put the timer. Wait a moment.
Ali's mother name is
Lisa.
Lisa. Is a 12-year. Okay. Good
Yeah.
morning, Lisa.
Okay. Good morning.
I'm Dr. Emma, one of the children doctor in this hospital. I believe I'm talking with Ali's mom.
Yeah.
Nice to meet you and thank you very much for coming here. Today,
Thank
I'm
you.
here to talk about Ali's health condition and writing some note. Is that okay with you?
Yeah.
Thank you. So can you please tell me what is your main concern to come here?
I feel like Ali is not growing well. Ali is shorter than his friends, and he has been bullied because of that.
I'm really sorry about this. So can you please tell me when first you noticed that?
It was about a few years ago when Ali, I suppose when Ali was 9 years of age, I started to notice that he is shorter than his friends.
Okay, I understand. So anytime you measure his standing height and sitting height, anyone?
I don't know, have idea about that.
Okay, okay. So how about Ali's parents' height? Like his father and mother height?
We both are tall. We both are tall.
Okay, I understand. Okay. That Ali started like puberty. His puberty started.
No, he hasn't started yet.
Okay. No any sign you have seen.
Um, no, any what? Sorry.
No any sign like beer, voice change, anything or private part increasing. Nothing you see.
Um, no, I don't notice any of those.
Okay, I understand. Understand. So how about Ali's parents, like you and your husband's puberty? Is it when started? Do you remember?
I remember my puberty was a bit late, but eventually it started and everything's looked fine after that.
Okay, understand. How about his father?
I don't have ideas because we were divorced.
Okay, I understand. I understand. So I want to ask about how is Ali's school performance? Is it okay?
Yeah.
Okay. And is there any unusual feature since Ali?
Um, what do you mean by unusual features?
Normal than any unusual features you notice, his face or his whole body, anything? How he
No,
looks
I
like
don't know.
actually?
Well, he's shorter than his friend. That's all I can see. But he looked like me, and then there isn't any concern.
Okay, that's very good to hear about that. Okay, okay. So how about Ali's? Does Ali have any fever?
No,
Okay. How his weight? Recent any weight change occur, or how is his weight?
I would say just normal.
No. Okay.
I did not
Uh,
measure though. I did not measure though, but he looked normal.
okay. And his activities,
What do you say?
behavior, his activity and
Mhm.
behavior is how?
Yeah, he's a bit sad because he has been bullied because of this height problem at school,
Okay,
so he's a bit withdrawn and quiet.
okay. We'll try to liaise with school about this issue. Okay. How is about Ali's sleep?
Steve has been fine.
Okay. And his school performance?
Um, I would say he's not happy at school, and he sometimes, say to me like he has headache, tummy pain in order to go to school. I feel like just because he has been annoyed by some of the school lads.
Okay, okay. So this tummy pain only school time he is telling.
Yeah, that's right.
Hmm. Do you have any other concern?
No, I was wondering what's the problem because I went to the GP and GP said to me that there might be something wrong with the organic problems because both parents' height is normal and Ali is growing, height weight is normal and does not have any dysmorphic problems. So the GP said that we need to rule out other organic problems by doing blood tests.
I understand. Actually, we will after this meeting will rule out the cause. So is there any chronic condition, long-lasting condition Ali is suffering?
No,
Okay. I have to ask some questions from his head to toe. Like, how about Ali ever complain about headache?
yeah, he sometimes before we asked him to go to school, he told me,
Mm.
I have had I can't go to school today.
Mm.
But these problems were never seen at in the weekend or when the school is off. So
Mm.
I would say that maybe just a kind of excuse for not willing to go to school.
Yes, understand. And this headache is associated with anytime vomiting.
No,
Okay. Anytime any abnormal movement you do,
no,
any loss of consciousness.
no.
How about Ali's hearing? His hearing,
Yeah, it's fine.
that's great to hear. And about vision, any eye issue?
No problem.
Okay. So I have to ask about Ali's anytime complain about racing heartbeat.
No, he never complained those.
Okay. Any chest pain?
No,
Okay. Anytime like he has any cough, repeated cough, shortness of breath,
no,
and his tummy pain. I know just on the school times. Is the tummy size increase?
no.
How about his poo?
He's a bit constipated, but I asked him, I forced him to eat a lot of fiber and drink water. That helped
Mhm.
with his poo.
Okay. Okay. Constipated. How long he is constipated?
It's been for quite a long time. I would say because
Okay.
he's quite choosy eater and he does not like vegetables and does not drink
Ah,
too much. That's why.
understand. How about his pee?
Pee is normal.
Does anytime he cold or hot intolerance anything he prefer?
No, nothing like that.
Any muscle pain, joint pain?
No,
Any rash in his body?
no.
Okay, that's really good to hear. So I want to ask about past. Anytime Ali diagnosed any case or admitted in hospitals?
No, no, no. He was so fit and yeah, well,
Okay, that's very great to hear. Anytime any surgery,
nothing.
any trauma?
No.
Okay. Recent any traveling you anywhere?
We went to Turkey 6 months ago.
Okay, that's very great. So he has puberty not started. So in this age, children are taking lots of experience like smoking, alcohol. Does he drink that?
I don't have any idea, sorry.
Okay, okay, I understand. So tell me about Ali's birth.
He was born about 7 days earlier than due date. And I ruptured the membrane, and it was normal, spontaneous vagina delivery.
Mm.
There isn't
Okay.
any problem after birth. Yeah,
Like he cry immediately.
he cried. Yeah,
No admission needed after birth,
No.
and all the screening tests that they done.
They did the hip prick once and they mentioned it was normal.
Okay, that's great. And it's just routine question we ask during your pregnancy time. Do you have taken alcohol or drink?
No.
Okay. Are his vaccinated up to date?
Yeah.
Does he has allergy to any substance or food?
He is seafood allergy.
Seafood allergy. So how you know that anytime admission needed?
Because when he was starting his weaning diet about 1 years of age, I started giving the prawns and he was getting swollen lips with confluence rash all over the body. He needed missions and they gave the life-saving medications, injection, and they told me
Mm.
that Ali has a problem with seafoods.
So they give you EpiPen.
Yeah, but no, well, I was having EpiPen, but we tried to stop all the seafood in his
Okay.
diet. So yeah,
Okay. So how his diet? Can you tell me?
he's a fussy eater. He like meat only. He does not eat too many vegetables. He does not like drinking milk. And he doesn't
Okay.
like drinking a lot.
Okay. I understand. So apart from his tall structure, other growing like he's walking, talking, everything according to his age.
Yeah, it's a short stature. I'm concerning only.
Okay. So can you please tell me about your family? How many people you're living together?
We're living with Ali, his dad, and one of his younger sister.
So Aris, that lives with you, like you previously tell me about divorce.
Um, well, yeah, it was fine. We haven't officially yet, but we have planned for that. So yeah, maybe in a
I
few months later, his
understand.
dad will go.
I understand. I
away.
understand. So how is Ali's relation with family? Everyone's. Is there a good environment?
Maybe because we have decided to take Ish with us, so maybe that might be a bit of sad to them, a bit of impact on them. I'm not sure.
Okay. So how his height condition affect you and family?
It's this height affect a lot on him with his confidence, self-esteem, because he does not have a supportive friends. Most of the
Mhm.
people
Mm,
in his schools try to bully because of this short stature.
mm,
They are not happy him coming and play the
mm,
doing the physical exercise, PE
mm.
activities, and so that keep a lot of self-esteem issue.
Okay. So you think Ali has that type depression? He does not live in this world. Sometimes he feels like that.
So what did you say?
Like he does not live in this world. Anything he do, any life threaten anything.
No, no, nothing like that. But I feel like he's a bit quite withdrawn and he is really afraid to go to school and he is not happy. And his teacher told me that he does not look happy at school.
Okay, I understand. I understand. So yeah. So who is the earning member in the family?
I am the one, yeah.
I think time is over. Okay. Is the income is
No, not
satisfied?
you have 30 seconds. Yeah.
Okay.
Yeah, yeah, it's fine.
Okay. So okay. Is there any emergency access to the hospitals?
No. We live in a bit of village side, so it's a bit difficult to go to the hospital.
Okay. So
Time's
thank you
up.
for your time, and I'll revise my note. If I have any question, I'll ask you.
All
Okay.
right, thank you.
Okay. So present. Today I have taken the history from Lisa, who is the mother of 12 years age old Ali. His chief complaints is that Ali is short in his whole class, which is started when he's 9 years age old. Mother noticed that. And on history, otherwise Ali is fine. Any other issue? There are some issue that his puberty is not started. Mother puberty also late. Father actually he's not mother doesn't know about father's puberty, and Ali is that is Ali's school performance is affected as so much school bullying and a problem occur. He is not good adjusting on the schools. He has some headache during school time, tummy pain. He tell he's long time constipated, um, and he is a fussy eater. He can't take appropriate fibers diet. These are otherwise his height. He's developing well. No any unusual features. Uh, so putting together, I think it is a case of short stature and with DD. And first, I'm putting constitutional delay of short statures. Number one. Number two, it the constitutional delay of short statures. We can say any growth hormone deficiency. Uh, um, this is familial short stature we can keep, but parents both are height is good. Though mother has late puberty, father does not exclude, and any unusual features. So syndromic, I'm not giving. So it is a constant delay of short stature.
Okay, what is the meaning of the short stature? How will you define short stature?
Short statures is when he is, according to growth chart, he is below 25th centile.
Height is less than that centine or below two standard deviation means of Asian sex. Okay. What is the difference between failure to thrive and short stature?
Failure to thrive, failure to thrive may be any organic cause present there, like any chronic disease. For that reasons, he is not gaining weight or any negligence is something. A short stature is not this causes. Another
Yeah,
list.
the failure to thrive greatly affect the weight first, then followed by height. Short stature mainly
Okay.
affect the height. Okay. So
Okay.
between second years to puberty, which hormones greatly affect the growth of child?
I don't get this question.
Which factor affect the growth from birth to 2 years?
Which factor affect the growth? Diet, I don't know.
Yeah, diet and thyroid hormone. Yeah, from
Diet,
two
thyroid.
to puberty, growth hormone is mainly factor affecting the growth. After the puberty, sex hormone, growth hormone, thyroid hormone affect the puberty, the growth. Um, what's the difference between familiar and constitutional short stature?
Familial short stature has a positive family history of short stature, where constitutional has not. Familial short stature bone stage is normal, bone age, where constitutional delay bone age is delayed. When we do the X-ray, we find bone age delayed. Constitutional. Familial short stature will be final height will be short, where constitutional delay, they later they can catch the height.
Okay, great. How will you manage this case?
Okay. So after already taken the history, I revise my note and I will examine the child. Examination of first general examination head to toe I will see, and height, weight, BMI according to appropriate centiles, and I will go for BMI 10 staging I will do, and these are I am doing examinations. I will talk with my consultant. I will run some tests like his bone age. We can check hormone test if needed. Sex hormone test we can do. Thyroid test we can do. As he has constipation, it is one of my DD. Um, this investigation I will do, and the management according to cause. If it is constitutional delay of short stature, then reassure psychological support I will give. I will liaise with the school multidisciplinary team. I will involve endocrinologist. I will involve liaise with the school educational healthcare plan, and also family counseling. I will do as that have divorce. They're taking decide. So family environment also. These are issue solved and reassurance. Constitutional delay of short stature is reassurance counseling that it will be take the height.
Okay. So suppose that the child has a growth hormone deficiency. What is the causes of growth hormone deficiency in children?
Okay. So growth hormone deficiency causes that first of all Turner syndrome. Um, it can be growth hormone deficiency. It can be any chronic renal failure. IGR patient not after the age not catch the height. Uh, these are
Okay,
endocrine
what is
causes.
the indication for growth hormone therapy?
What is the
Indications,
contraindication?
indications for growth hormone therapy.
That I tell you, Turner syndrome, chronic renal failure, growth hormone deficiency, um, any chronic disease. Then, if these
Okay,
are,
what is the side effect of growth hormone?
what is the
Side effects of growth hormone.
side effects? Side effects are headache can be present, pseudohypoparathyroidism. Um, these are
Pseudotumor cerebri, yes,
yes.
and primary hypothyroid, gynecomastia, liver abnormalities,
Okay.
hyperglycemia. All right. And how will you investigate for growth hormone deficiency?
Growth hormone level we check. I don't know.
Yeah, growth hormone level,
Yes.
and after provocation with insulin, clonidine, or propranolol, or insulin growth factor 1, insulin growth factor 3.
Okay.
Okay,
Okay.
all right. Um, yeah,
So
I
this
think you did very
questions,
well.
these
Hmm?
questions from you are asking from Khidir book, right?
Yeah, yeah, that's right. You did very well
Understood.
because you're not following the textbook. You are following the patients. When I deviate you with like constipation, headache, you do not follow the page that you've read. What you follow is that you follow the patients. So you immediately exclude the red flags related to the headaches, red flag related to the constipation. So these are very good. And then your management, you include the patient first. For example, you mentioned me that you will do thyroid because the patient has the constipation, so these are very good. And the only thing I want to add is that in the management, start with, first of all, you will measure the child height and plot on the appropriate growth charts. Do the mid-parental height again. You will calculate the mid-parental height and also calculate the target height for a target at that height for him, and you will do bone age, because in order to differentiate between familial constitution, another way is bone age, and you will also do routine blood tests. And based on that, if you feel like it's constitutional, you will involve your consultants and you will reassure the parents. But if it is the organic cause, then you will discuss with the consultant and you will do the investigations according to the child presentation.
Okay, understand. So how is the history structure organized?
Yeah, yeah, it's organized and it does not look like you are memorizing something. It's look like you are following the patient. That's good. Some of the problem with the candidate is that sometimes they read the book a lot and then they follow the book. They doesn't follow the patient, and that is really um non-impressive in front of the examiner. But you follow the patient. That's a very impressive one.
Okay, thank you.